by 2050, nearly half of the world's population will be myopic. I'm sure as optometrists and eye doctors, we've heard that a lot. But why does it matter? Now, we know that vision is very important for kids, and they definitely need it in their development, in their learning, and also that myopia, nearsightedness or also short-sightedness, is something that is becoming increasing. It is increasing definitely throughout the years, and it's just getting more and more as time goes by. However, there is good news because why? We can actually proactively manage myopia. We can actually prevent it from getting worse and also potentially reduce the risk for all these kids who are going to be short-sighted in the future. So in this episode, we're going to delve into the world of myopia. We're going to explore why managing it early is crucial, especially for our young patients. Now, my name is Shafiq, and I am an optometrist. I've been actively managing myopia for over 5 years now, and I'm really fortunate to be practicing here in Australia because we do have access to all the different myopia management or myopia control options, and I have prescribed pretty much all the main ones here. Now, I do understand that I was once a young optometrist. I once didn't really understand how do I go about managing myopia. It was really hard. I was clueless. I had to look at like tons of resources, and that's the reason why I am doing this personally, to be able to help other optometrists like yourself, young optometrists and eye doctors who are early on in your career, to be able to confidently manage myopia. Quick disclaimer: all information, content, and material of this podcast are the opinions of the speakers and as for the informational purpose only, and not intended to serve as a substitute for the consultation, diagnosis, or in medical treatment of a qualified healthcare provider. Firstly, let's talk about myopia. What is really myopia? So we know that myopia is nearsightedness or short-sightedness, but basically what it is that when your patient looks far in the distance, or when someone looks far in the distance, they see things a bit more blurry. Now, because when things are blurry in the distance, they can only see close up. That's why it's called nearsightedness, so that they can only see things up close. And we understand that in myopia, what happens is that the light rays that should technically form or should fall on the retina, it actually falls in front of the retina, hence causing that blurry vision. And we know that the eye cannot accommodate the light rays to focus on the retina itself, to push it backwards. That's why our friends who are actually long-sighted or who are hyperopic, they can actually accommodate a bit to make their vision clear. But for us, for those of us who are myopes, including myself right here, I cannot accommodate my vision to see clearly in a way, all right? So that's the main thing about it. And yes, it has becoming something that is growing globally. So I actually grew up in Singapore, where my parents are actually both do not wear glasses. They're not even short-sighted. This was a couple of years ago, but when I checked their eyes, they actually maybe had a bit of astigmatism, and if anything, they're slightly like hyperopic. But here's the thing: I grew up, I study a lot, I did a lot of close-up work, I rarely spent time outdoors, and I think that was really what that made me myopic in a way. And let's talk about the concept of axial length, because we know that in myopia, what happens is that the eyeball is actually growing longer and longer. And because of this axial elongation, that's the reason why someone gets more and more myopic. So, for instance, someone who's maybe a -2 diopters of myopia, or in some places, I know we say 200 degrees for the glasses. What happens is that the eye has actually stretched out a bit more to be a bit longer than what it should be. Now, as they go on to not have a lot of time outdoors, as they start to spend a lot of time doing close-up work, that's where the issue comes, and the eye just keeps growing longer and longer and longer. And one of the reasons why we think this is happening is because of that defocus that happens in the periphery. What happens is that with normal like single vision lenses, when they wear those lenses, it does help to correct the vision, but the peripheral light rays actually falls behind the retina, and it's believed that that might be one factor as to causing the eye to grow and elongate even more. So let's talk about it. What is the impact of unmanaged myopia? So we're going to discuss a bit more about what is like the potential health consequences of unmanaged myopia in childhood, because the thing is that when they are young, the only issue that they have is their vision. Their vision gets blurry. But what happens when they grow older? When they grow much older, there is an increased risk in like glaucoma, in like retinal detachment, and also in myopic maculopathy, which is basically damage to the macula itself. Could be also due to the stretching of the retina because of the axial elongation. So let's talk a bit about glaucoma itself. We know that glaucoma is an eye condition where usually it does affect the optic nerve, the back of the eye. Sometimes can be due to high eye pressure pressing on the optic nerve, hence causing a loss in the peripheral vision, which eventually, if it is advanced enough, it gets to tunnel vision. Now, the second one is the one that I think most of us would know about, retinal detachment. Now, the longer the eye is, the more prone it is to being detached. And that's why we do recommend not doing high-impact activities for our patients who are very highly myopic, especially those who are in the high myopia range. There will be, it depends on the papers that you're reading, it's either -5 or -6 and above is considered high myopia. And we do want them to really try to stay away from activities like bungee jumping, skydiving, taking roller coaster rides and all that. And this is not saying that they can't do it. They still can, but just make them aware of it, that these are the things that is really high impact on the retina that might cause a detachment. And if there is a detachment or a tear, it needs to be fixed as soon as possible. Now, the last one, myopic maculopathy. This is the one that affects the macula itself, which we know is important for the central vision. So when it affects the central vision, the visual acuity, or the VA, would eventually decrease. So from being able to see like 6/6 or 20/20, which is perfect vision, it might drop. It might drop to, maybe like a 6, 7.5, or even 6/9, or that would be 20/35. All right. Yeah, as you can tell, I am very used to the 6/6 other than the 20/20, but just bear with me on that. All right. So next thing, let's talk about the economic and social burden of unmanaged myopia. Hey guys, real quick, if you're an optometrist or eye doctor early in your career and you want to learn how to assess myopia risk effectively in kids, download my free PDF toolkit. Inside, you'll get a questionnaire for parents to fill out, a checklist of in-room tests to perform, and a comprehensive myopia risk assessment table to further understand your patient's myopia risk and to determine whether to refer or manage them. Now, you can go and click on the link in the description down below and take your first step towards becoming a myopia management specialist. Now, the thing about it is that healthcare costs would eventually go up, because if we think about it, if someone has low myopia, most probably if it's managed and if it's controlled well, until to a certain stage, as long as they're not doing too much close-up work, as long as they do spend time outdoors, the myopia should not really progress much in a way, which is what we do want. The issue comes when they have high myopia, and eventually what happened, because of the increased risk of retinal detachment, glaucoma, myopic maculopathy, it is actually a bit of a burden on the healthcare cost. It's either on the patient themselves or for the country that they are living in a way. So if you have a look at it, the lower we can keep someone's myopia, especially when they are young, the better it is for them, for their pockets, but also for the government's pocket in a way. Not that I'm saying that that there's anything wrong with it. Of course, wherever that we live, we do want to get like the best support from the government and all that, but also it's all to do with the time. Like, think about it, all right? So if you have a kid who has really low levels of myopia, but we didn't really control it when they're young, when they grow up, maybe they're now a -8, -9, or even a -10. What happens if they get a detached retina? So they would have to go and see an ophthalmologist who would be most probably a retinal specialist who can repair the back of the retina. And it depends on what's happening. Is it a tear, or is it really the whole retina coming off the eye itself? So there are different things that needs to be done. And we know that in some countries, the healthcare cost is on the patients themselves. And in some countries, we might be a bit more fortunate where if it does come to those kind of emergency surgeries, it will be covered by the healthcare system. But that being said, they do have to spend time to, of course, travel there to get their eyes fixed. And these are the things that we just have to be a bit more aware of in a way. And the next thing, yes, productivity loss. So they can't be as productive in their life. And, you know, from me, myself, being a myope, I'm actually a high myope. All right. My prescription on my right eye, just to share with everyone, it's a negative 650. On the left eye is a 4.25 with a 0.75 SIL. So as you can tell, I have a bit of anisometropia, plus I have a high myopia in one eye, a bit of SIL in the other eye. So I do understand how it's like. So growing up, you know, like I'm so dependent on my glasses. For the first 18 years of my life, I never touched contact lenses. The first time I actually touched contact lenses was when I was actually doing second year optometry. This was as a student back in Singapore. So that's where I actually learned to put on contact lenses. And the first pair of contact lenses, it took me 1 hour. It took me 1 hour to get one piece of lens into my eye, because that was how afraid I was. But coming back to the main story why I say that is because throughout my whole life, every time when I don't have my glasses with me, it is much of a nuisance. I remember when I was in secondary school, right, playing basketball, I was outdoors, the glasses is always slipping off my face. It's not comfortable, but I know that that's the only way that I can see. And of course, back then when I was like 13, 14, 15, 16, I was afraid to wear contact lenses, and I never wanted to touch my eye. So these are just a few things that we know that, like in terms of the healthcare cost of the day-to-day activities, it's all actually being impacted. So let's talk about myopia management. So we do want to take a very proactive approach for it, because this is something that is really beneficial for the patient and for everyone in general. And the reason why is because we do want to slow down the myopia as much as we can. We know that kids are going to grow, so their vision might eventually get worse over time. But what we also want to do is to make sure it doesn't go up too high in a way. So for instance, if they're at a -2 at 8 years old, maybe by the time they're 16, 17, they might be projected to be like a -5 or a -6. But hey, what happened if we can actually bring it down to them eventually maybe becoming a -350 or even a -3 instead of them being a -5 or 6? So as you can tell, that's a really huge difference. And we know that there is a lot of factors that's involved in it, which we are going to be going through in the future. So the understanding of myopia management or myopia control is that it is not a cure. Myopia management is a way to reduce future risk of any potential diseases or eye conditions that can come if we do not manage the myopia well while they are still young. And of course, we know that for myopia management, there's actually a lot of options that is available out there these days. So there is the very straightforward, or maybe one of the ones that has been out there for a while now, is actually orthokeratology. So these are the hard contact lenses which our patients can sleep in, and overnight it gently reshapes the cornea so that when they wake up in the morning, they take off the lenses and they will have nice clear vision. Next one is actually atropine eye drops, which was actually been around for quite a while now. A lot of research studies done on it. In fact, one of the big study was actually done back in my homeland in Singapore, where they had a really big study over a long enough time period to show that low dose atropine does help to slow down myopia progression. Next one, something that is a bit more recent, slightly a bit more recent in a way, would be the MySight contact lenses. Yes, they have been around for a while now, so I'm not saying they're super recent. Yeah, but the MySight contact lenses definitely did change the field a bit more, because orthokeratology it does come at a much more premium price. And a lot of patients or a lot of parents do find that, hey, with the mindset lenses, I can kind of like break down the payments in terms of like how much lenses that they order. Maybe they order 3 months supply at a time. So that does help to break it out a bit in terms of the cost for the patient, or I would say for the parents in a way. Yeah. And after that, let's talk about something that is, yes, a bit more relatively new. Maybe I'm pretty sure it's less than 10 years, right? Which is the myopia control or myopia management specific spectacles. Now, this is actually very interesting because we know that a lot of the big brands have actually come out with spectacle options for myopia management, and it has actually changed the game a lot because a lot of parents or a lot of patients who would have not been able to afford like orthokeratology or even the MiSight contact lenses, now they can actually afford these spectacles a bit more. So as you can tell, as time goes by, we're getting closer and closer. And also something that I've been seeing a bit more about, although I won't dwell on it too much, is the use of atropine. Atropine is still good, it still has its place, but I see that there's less use of it, especially here in Australia, now that we have other options that's available. But I would say that with our ophthalmology colleagues, they are still really pro for using the atropine drops in a way. Yeah, and one last one, which I'll briefly mention about it, and this is something that is really, really new compared to all the other ones, is actually low-level red light therapy. Now, personally, I myself have not actually prescribed this for my patients because in the practice that I work at, we do not really have access to it. But this is actually really interesting because in some of the initial studies actually that has been done, it does show that it actually helps to that the axial elongation, like they are actually getting a regression of the myopia instead of a progression. So this is actually pretty interesting to see what are like the long-term side effects of it. And again, I won't dwell too much into that as for now, but just know that that is an upcoming option in a way. Yeah, so as we know, myopia management is very important, and especially to have early intervention. The earlier that you can intervene, the better it is going to be for the outcomes for our patients. So we ourselves as optometrists and eye doctors should do what we can to really make our patient understand as to why myopia management is important and why we do need to why do we need to do it as early as possible, if possible, at the first sign of myopia. Yeah. So I would like to actually share a bit of my experience in managing myopia. Again, like I mentioned in the beginning of the episode, I've been doing this for a bit over 5 years now. And now more than ever, I am actually much more confident in it than I was before. And I'm really glad that like I do have colleagues who would actually ask me, and some of my colleagues actually have worked longer at being an optometrist, but they maybe might not know as much in a way about managing myopia. It does show their humility and how much they actually want to help their patient in terms of like really trying to give what's best for the patient in a way. Yeah, so one of the stories that I share, this is actually my very, very first orthokeratology patient. So one mentioned her name here, but when mom brought her in, she was 8 years old. I think she was turning 9, and her myopia was already at a minus 350. Now, back then, I did not have any access to a biometer, so couldn't really measure her axial length. But what happened is that we actually decided to do orthokeratology for this particular patient of mine. And it was honestly one of the best things that we have done for her because even mom was really, really happy as to how it was. So my patient, she was okay with wearing glasses, but she didn't really like it as much. And that is a common theme that I found, not with all, but most young girls in a way that they actually do prefer to wear either contact lenses or orthokeratology because they do not have to wear glasses physically on their faces. And one thing that we did, although she was 8 or 9, and in her first year wearing orthokeratology lenses, Mom and dad were very involved in how they had to literally every single night, almost every single night, help her to put the lenses in her eyes. Now, but of course, eventually, as she grew a bit older, I think after about a year, she could pretty much do it herself. And yeah, that just shows that with some kids, they might take a bit quicker. Some kids, they might take a bit longer in order for them to do different, just to learn how to insert contact lenses into their eyes. So I've been seeing her now for the past 5 years. And in fact, I just saw her about 3 days ago. Yeah, that's right. So 3 days ago. I just saw her 3 days ago, and it's been about 5 years. She's 13 going 14 now. And the thing is that it's just amazing to see how her myopia have not really progressed much. And now that I have an access to a biometer, we actually measured her axial length, right? And guess what? It was actually sitting at 26.19 in one eye and 26.14 in the other eye. So for her age group, she's definitely in the higher progressing myopes, and we had to change her ortho K lenses once. This was about 6 months ago, and when we changed her lenses, then we did do a full washout and we compared her prescription. Guess what? In 4.5 years, she only increased by 0.75 diopters. That's it. 4 years. And before she saw me, just to give a bit of a context, the year that she saw me, her prescription jumped by 1.25 diopters each eye. And when we did the full washout, both eyes just increased by 0.75 diopters after 4.5 years. When I shared that with her mom and dad, they were really happy. They were like, no way. They thought the child's vision had gotten way worse because, just because they do expect it, knowing that that is actually a low myope. So that I think is about maybe a minus 150 or at most a 2. But mom was actually a really high myope. I'm pretty sure she was a -9 or a -10, right? So it's a really high prescription. And the fact that she knows that that's what that her child might be heading into and wanting to take that proactive step to stop it now that they can, or to actually slow it down now that they can, they did all that they can do in order to help their child in a way. All right. So that is a really successful case. They're still seeing me till today, every time for a review. And just because of the axial length, I am actually bringing her back in every 6 months just to make sure that the myopia isn't really progressing much. Because if there is any sign of progression, we want to get on top of things as soon as possible. Now, the second patient that I do want to share about is actually also another orthokeratology case where I'm pretty sure it was about maybe 6 to 9 months after my very first ortho-K patient. Now, he was a 11-year-old boy, very, very well-kept and intelligent boy, I would say, for his age. So he is one of my patients, I would say, who is really diligent. Would literally the handout for the ortho-K when I give him, usually I know that most patients and most parents won't read it. His parent did not read it, but he himself read it, and he actually told me about it during one of our follow-ups and all that. So really proud of him. But in any case, yes, this was a bit of a challenging one because he actually had against the rule astigmatism. And with fitting ortho-K on against the rule, it is a bit more tricky because even after I fitted him, he had a bit of a residual seal in his eyes, or residual astigmatism of about 0.75 in each eye, but he could still see very well. Nighttime, a bit of glare, a bit of, I don't think he got any halos, but he did get a bit of glare, but it was something manageable. And that's one of the things, just a bit of a segue, that you will find with kids is that they actually are much better at adapting to all these small little issues, if like a bit of blurry vision or, any issues that they're basically having with their eyes. they can actually manage it much better than most adults in a way. And I do actually find it very interesting. Like, why do kids are able to, even with some of the ortho-K kids that I have fitted, they would get like 6, 7 vision, and they'll be really, really happy. Well, I have heard about like adult cases with some of my colleagues who, even with like 6 vision, some of the patients feel that their vision is not super clear. So yeah, this is just something that's really interesting. Anyway, getting back to the story. So he saw me when he was 11. Mom and dad knew that they wanted to do ortho-K for him. I'm pretty sure his first appointment, he did come with his dad, and they pretty much knew that they wanted to do it already. Dad himself was short-sighted, and he has done LASIK, and he knows that he doesn't want his child's vision to get worse over time also. So we did myopia management for him, and after 4 years, he did see me not too long ago, actually. It was probably just maybe a month or two back for his review. We did, again, change his lenses sometime in about 6 months ago. Yeah, and then when he came back for his review, we had a look at it, and things were great. And when we had to change the lenses, also, we did wash him out. And guess what? 0.5 progression. 0.5 in both eyes. And this is after 4 years. And before he saw me, his vision actually went up both eyes by 0.75. So as you can see, 1 year up by 0.75 and now 4 years up by 0.50. That's a super huge win. Now, I'm not saying this to say that all kids are going to respond the same with ortho-K lenses. Some of the kids are maybe going to respond better. Some are not going to respond as well. And there are some of my patients that I have done dual therapy where I actually combine ortho-K plus low-dose atropine. So those are things that we can probably discuss a bit more in the future, but I just want to share some success stories. And I have countless of success stories of patients who have started myopia management, either in with ortho-K, MiSight, soft contact lenses, myopia control glasses, or even with the atropine drops itself only. So these are all the ones that I have personally fitted on my young patients, and it is something that is relatively still new these days. Not a lot of parents have really heard about myopia management. Even when I talk to my friends who are not optometrists or eye doctors, even they are like, what? You can actually manage myopia? You can actually control myopia these days? And I'm like, yeah, we can. And they were so intrigued. They were like, oh, so you don't just get normal glasses or normal contact lenses. And I said, no, there are other options that we can look at. And they were blown away. They were like, oh, wow. Now, I did tell them, yes, these options do come at a cost. It is much more expensive than normal glasses or contact lenses. But for most of them, the way that they see it is like, if this is going to benefit their kids in the future, or even some of them now who are still progressing a bit, why not give it a go? So that's how much confidence that some of either my patients or my friends have in this whole myopia management thing. I know that in the grand scheme of things, myopia management is still considered something that is new, and it's something that more and more people needs to know about it, and it's something that I personally find it as a personal mission to make sure every single optometrist and eye doctors who are keen on managing myopia effectively, that I want to help you guys out.